Hi guys, this is just a basic tutorial on just to get you familiar with what's available in the orders and results section within Athena. I think of this area as like your grocery shopping. So you can add multiple things into the chart and then you can divide it up by category. In our case, it would be a patient's diagnosis. If they have multiple, you can organize what you're doing that way. So under the diagnosis and orders section, you'll see point of care, which has all of our point of care tests that we do and some additional tests. You'll notice that our EKG is in this section. This is the proper EKG to use. Visual acuity. These are in here because we made our own templates for these procedures. So for wound care, for example, we created this simple guide. So other things that you can add in here are notes to return to work. So you type in the word note, and it's this one right here. This is if you go to discharge a patient and they say they need a note for work or school. You would add it under the diagnosis that the doctor already had in the chart. You open it up, you put it under care from today's date, and then we give 2 days max unless the physician says otherwise, and then they put it in. Otherwise, if we do more than 2 days, we have to fill out FMLA paperwork. So we usually just fill this section out with if they want today off, if they missed, they get 1 to return the first. If they went to work this day and they want 1 2 days, then they can return the second. And then any of this, when you're done, you would just hit sign orders. I'm in a test patient, so it's not allowing me. Other things you're going to find in here, say the patient has pharyngitis. You can hover over the diagnosis. You're going to hit this plus sign to add anything you want to this grocery cart. And say you want to care notes on pharyngitis. Oops. You can see here sore throat care instructions. You can click on those. You have to open it up and make sure that the source right here says Healthwise. Otherwise, it won't print. This ultimately does come down to the provider's job to put this information within the chart, but if they forget, you can put it in. Other things in here, this is where the doctor puts medications in. I don't foresee us ever putting medications in, but we use bacitracin. Bacitracin ointment. Anytime a doctor puts in a prescription that they want us to give in office, it has to be in administered status. If it's in prescribe, it goes to the pharmacy. You can see how it says send to Walgreens drugstore. If a doctor says, I put bacitracin in for the patient for you to give to them and you can't task it off, it's because it was in prescribe, not administer. So that's just a good lesson there. If you have issues, always make sure that it's in administer. Another good one is always make sure that any culture we do is in office setting. If it's in external lab, it goes in as an order. If it goes in as office, it goes into Athena that we are collecting it, which is what we're doing. Otherwise, you're unable to task it off. You'll find splinting instructions in here, or any durable medical equipment we have. So let's say knee immobilizer. You just start typing it. You can click on knee immobilizer. And then in here, again, we don't want it to go in as a prescription. We want to dispense it here. Otherwise, we don't get paid and it doesn't go in that we did it. You always want it in as dispense. Again, you're not going to be able to task it off if it's in wrong. But these are just helpful hints that if the doctor orders something wrong, which they frequently do because they're moving so fast, these are some areas that I would look at. And by all means, if a doctor orders a knee immobilizer wrong, you can take it out and add it in correctly versus waiting for the doctor to come out of the room and then do it. So that's just a quick tutorial. Once you add in anything up here that needs to be additionally tasked off, like say I put in this knee immobilizer, and if I were able to sign it, I would hit sign. It would come down to this outstanding order section. And then it would say perform, and you would click on it here and task it off. So it's always this area here is where you do your shopping, and this is where you check out outstanding orders. Okay, thank you.